Now, in the Health Watch, Dr. Mallika Marshall joins us with some questions that viewers had asked this week, and so we want to get right to them. The first question is from Susan on Facebook. She asks, I have high blood pressure and am taking, how do you pronounce this drug?
Amlodipine.
Amlodipine. I am going to be 70 years old next week, and I don't want to get dementia. What should I do? Is that a risk?
Well, so I think she's referring to a study that I actually reported last week about how your systolic blood pressure, which is that higher number when you get a blood pressure reading, how elevated systolic blood pressure has been linked to an increased risk of dementia. So Susan, I would say that if your blood pressure is in really good control with diet and exercise and taking medication like amlodipine, that you're really doing everything you can to reduce your risk of dementia from uncontrolled hypertension. Now, there are some other things you can do to try to reduce your risk of getting dementia, including exercising regularly and eating a healthy diet, maintaining those social connections. You want to make sure you get out with your friends and your family, and then maybe do some mentally stimulating activities like taking a class or learning a new skill. You might want to, I don't know, take Spanish or Mandarin or something.
The older you get, the more you realize how important your relationships are to your health.
Absolutely.
It's
My
crucial.
mom's in her 80s and I'm like, go spend time with your friends.
Oh,
so
yeah.
she does.
Well, Maria on Facebook wants to know, what happens if somebody accidentally receives 2 bivalent COVID booster shots 2 months apart?
So, Maria, it really shouldn't be a big problem. I mean, it's generally recommended that you get that COVID bivalent booster at least 4 months after getting your last regular booster. Everybody needs to get their bivalent booster. And that's really to sort of enhance your immune response. But if you get two months apart, it shouldn't have any adverse effect on your health. However, don't get another one until we hear from health officials that it's time.
Good warning there. And Jen on Facebook writes, my son is 17 and tested positive for RSV. He was out of school for 3 weeks due to a bad cough. Please tell people that anyone can get sick from RSV, not just the babies.
Yeah, I mean, you're absolutely right. I mean, RSV does tend to cause more severe symptoms in young babies and in older adults, but anyone can get pretty sick from it. I think my mom had it a few weeks ago and had a case of bronchitis. I just saw a mom a couple of days ago who caught it from her young child, and she was having wheezing, so people can get pretty sick. So even though RSV cases have dropped considerably since a couple of months ago, we are still seeing some sporadic cases out there. So really, we should all be doing everything we can to reduce our risk of RSV, COVID, the flu, and there are other respiratory viruses out there that are wreaking havoc.
But we should also say the RSV and COVID and flu numbers appear to be down right now, a little bit better?
Yes, that is absolutely true. We're really happy to see that. But again, you can still get sick. Still seeing a lot of colds out there.
All right, Dr. Mallika Marshall, thanks so much. Dr. Mallika offers her best advice, but as always, consult your personal doctor before making any decisions about your health. If you have a question for Dr. Mallika, here are the 3 ways to reach her. Email or Dr. Mallika at cbs.com, on Twitter at Mallika Marshall, or Facebook message her, Dr. Mallika Marshall.